Hi, my name is Brittany Smith, and this is my audience.
Sharon Crump.
Harold.
Crystal. Today I will cover diabetes type 1 and type 2. Have you ever noticed that there's strange boxes in certain public bathrooms and wondered what those are? Well, those are actually needle boxes. And the reason why they're there is for diabetics to properly dispose of their insulin syringes. So I'm going to try to explain the process of the pancreas, how that works with diabetes, what causes diabetes, the differences between type 1 and type 2, the treatment, symptoms, and complications of diabetes. So first, what is the function of the pancreas? Well, the pancreas helps produce enzymes to digest food. It also produces two hormones, insulin and glucagon. So if blood glucose is high in the body, then the pancreas will produce insulin, and that insulin will signal cells to take in glucose and use it for energy. It also signals the liver to store glucose into glycogen for later use. If glucose levels are high in the body, then this will signal the liver to break down glycogen into glucose again, or it will break down amino acids into glucose, or break down body lipids or fat into another form of energy instead of glucose. So now that we know the role of the pancreas, we can explain diabetes a little easier. What causes diabetes? Type 1s are caused by a combination of genetic predisposition and environmental factors that's still quite unknown. Type 2 is caused by insulin resistance. Insulin resistance is the process of the pancreas producing insulin, but the cells are not using that insulin. So the pancreas works overtime to produce more and more insulin, so that finally the pancreas is worn down and it produces some insulin, but not enough to keep up with the body's demands. Let me use a demonstration with a key and lock to help explain this a little better. This lock is the cell that needs glucose for energy, and the key is insulin. So once the insulin enters the lock, the glucose can go through and it can have energy. But whenever the lock is having trouble, like in insulin resistance, the pancreas produces more and more keys, and so you will get the glucose into the cells for energy, but that pancreas is working so hard to keep up that eventually it gets worn down and there is less and less keys, and you are type 2 diabetic. So now that we understand diabetes, we can cover the treatment. Type 1s must be treated with injectable insulin because their body produces none on their own. Type 2s can be treated with oral medications or injectable insulin, or both. Oral medications work in different ways, such as helping the pancreatic cells to increase insulin production. It helps receptors to enter cells easier, and it decreases absorption of carbohydrates into the intestines. Lastly, we can cover about your risk factors of type 2 diabetes and what are the symptoms. Well, risk factors for type 2 are unhealthy eating, obesity, and a low level of physical activity. Type 2 also has symptoms, but the symptoms of type 1 usually develop earlier in life because it is triggered earlier in life because it's mostly genetic. So the symptoms are urinating often, feeling very thirsty and hungry, extreme fatigue, blurry vision, slower than usual healing, weight gain, or weight loss, tingling pain or numbness in hands or feet. Lastly, I will cover the complications of diabetes. Type 1s usually have more complications and more severe complications because it's developed earlier in life and that damage has accumulated for a longer period of time. The complications occur because of high levels of glucose circulating through the body, and that causes damage to the blood vessels, it decreases blood flow, and also causes nerve damage. Slow skin healing occurs. The kidneys are damaged, vision and eye structures are impaired, nerves in the stomach can be affected, and the legs, which either cause pain in the legs or delayed gastric absorption in the stomach. Also, the decreased circulation in the lower extremities can also cause amputation. If blood sugars are too high or too low, that can cause a coma or death. Now that I've covered the basics of diabetes, hopefully you will now know your risk factors and have more knowledge about your symptoms and can understand some of the treatment and complications. As a nurse, I see diabetic complications quite frequently, and most people are scared to take too much insulin or to treat their diabetes too much because of the risk of low blood sugars and death. But if their blood sugars are let to run very high, they usually have severe complications such as neuropathy and amputations. So I think that proper treatment needs to be focused on in the public more, and hopefully I've helped achieve that in small part today. Thanks.